Welcome to DrJLT Economics. I'm Dr. DrJLT. In today's episode, I want to talk about the new bill that Bernie Sanders and some Democrats are introducing in the United States to address tuition in higher education. I know that I promised in the previous episode that I would make a podcast on the failure of the Eurozone, but I haven't had time to do that just yet. But today I saw that this new bill is being introduced, and I just want to make a quick comment because I think this is going to be very dangerous, and yet this is going to really hurt the people who are most supportive of this measure. Let me explain. There is little doubt, I think, in anybody's mind that the United States is different from the rest of the world in that it spends per capita the most in education and in healthcare, while at the same time it has the highest prices in healthcare and education. That's the highest out-of-pocket costs, right? So why is this so? This is because of lobbying, right? It's because of corruption, and this is basically crony capitalism as a textbook example, right? Before I go deep into the higher education situation, let's look at healthcare. I think most people, whether you are American or you are not American, have a good understanding of why healthcare cost is so high in the United States. It is so high because the entire system is corrupted, right? There is this insurance company which stands in the middle, which jacks up cost, right, but provides little service other than to profit from the process. And the money that is being spent by the U.S. government per capita is higher than all the major economies that offer free healthcare. So how is it that with that much money subsidized to the insurance companies, the Americans still have to pay the highest cost to buy insurance, and then after buying their health insurance, they have to pay some of the highest out-of-pocket co-pays on top of that. Well, there is no other explanation except that the system is set up this way, right? And of course, the health insurance companies are not the only ones to profit from this. There's also the pharmaceutical companies who are able to charge a different price for different region, right? And in the United States, it just so happens that there is no rules that prevent them from charging whatever cost that they can get away with, and the consumers and the doctors, because they have their insurance, which is very high. They have purchased that insurance, so they don't care what's the price of the medication, of any medication, right? Because you have to pay out of pocket this certain amount, and above this, perhaps it's all the same. You don't care, and so this is why everyone's health insurance is high. And that is not the whole story. Then there is the doctors and nurses who have their education, during which they have jacked up a large quantity of debt, right? So they have to, in order to justify their education, their training, they need to be paid a lot higher than it is the case elsewhere in the world. And there's also the problem with the litigation. Americans like to litigate, and when they have some medical accidents, they can sue the doctors for large sums of money, and all of this have to be costed in, right? They all have to be costed in, and this explains altogether. They explain why healthcare cost is so high. Now, another part of this story is education, because I think someone has made this observation. I believe that this person is correct, which is that among services in the United States, among the world, in fact, around the world, nothing has gone up so much in price than healthcare and education in the United States. Of course, real estate is another thing, but it's not a service. If we take into account things that have just gone insane in the last 3-4 decades, it is real estate, it is healthcare, and it is education, higher education. Why is this the case? Because these are the sectors which have the most regulations, and regulations written in such a way that basically makes the insiders enriched, that enriches the insiders, penalizes people who have to purchase these services or properties. So why am I comparing the bill that Bernie Sanders is trying to introduce to the healthcare situation? Well, I see a lot of support. I think there's a huge amount of support among middle and lower income earners in the United States. They are excited. I think perhaps the Democrats will run on this in 2022 and maybe 2024, and perhaps they will win. And really, it is the case that people, I think, I don't quite remember who said this, but I think it's also quite true, which is that voters usually get what they wish for, good and hard, right? So basically, that's something like this. So basically, be careful what you wish for. The details in a bill like this, is that it's going to be a combination of public subsidies from money printing, which I have talked a lot on this channel, so I'm not going to repeat. I'm not going to repeat here. So they print money, they give the money to the education system, and then what they are going to do, the education system is going to jack up their tuition, right? People who qualify for free education are right, but people who don't qualify, the tuition will be jacked up, and then of course the government will give more money to those institutions. That's basically what is going to happen, right? What is the correct way to do this? The correct way to do this is to have free higher education. It is not very hard. A lot of countries around the world have free higher education, and they have very good quality education, right? So there is nothing there. It is not very hard to do. Of course, I was in academia, and I deeply understand that a lot of people who, after they receive their PhD, they wish that they get a job in the United States, and I did too, right? Because if you find a professor position in the United States, you're guaranteed to get paid at least double, perhaps 3 times the amounts that you would get elsewhere. And why is that the case? Because the tuition is much higher there. But if you think of education as a public good, then you could argue that making education free and all the employees in these higher education institutions in these universities get paid by grades, they are, of course, the professors will get paid less. By the same time, I think the tuition will be much the education, the cost for education will be much lower. It will be basically already covered by whatever the amount that is already being that the U.S. government is already paying, right? So it is, if you make it free, it really interestingly, actually it costs less. It is exactly the same as the argument for healthcare for all, Medicare for all in the United States, because when this everything is made free in a single payer system, actually the cost comes down and the public expenditure will come down, and people will have better services. Such is the situation. Of course, there is an alternative, right? As is the case with healthcare. With education, as with healthcare, I think you can also do it with free market. In a free market system, in education, the government will not give any money to those universities, right? And the universities, what could they do? Well, they have to do like every other company, every other corporation in the world. They have to try to run a profit, or at least to break even, and they need to try to cut their costs, right? And of course, they will have to compete on price, and eventually, I think the cost will be lower. Of course, it won't be free, but then of course the tax could be lowered. Tax, because you pay either way, right? You either pay in a free market system directly for your education, or in a single payer system you pay via tax, and then you enjoy the service. Both of these solutions, I think, will be much better than the crony capitalist way, which is being championed, and I see a lot of support, and I deeply believe that unless the U.S. enters World War III, which perhaps the current administration or regime rather is trying really to incite, unless the U.S. enters World War III, I think in the next 4 or 5 years they will get what they wish for, and then they will see their tuition go up. They will see the quality of their education come down, and they will see that there will be new co-pays and other fees that will come up, and they will be quite exorbitant, and people will be very happy because they got what they wish for. All right, so that's what I have for you today. Thanks for listening. I wish you a great day.